So diseases of the vitreous body, glaucoma, and cataract. So what's glaucoma? I know this is in the wrong order, not my fault. So glaucoma is when there's an increase in the intraocular pressure, which isn't compatible with a healthy eye. How is this caused? Well, we kind of said it a bit in the previous question. It's because there's more pressure in the aqueous humor, or obstruction of the aqueous humor outflow, which basically means, this also increases pressure. You also might get increased orbital venous hydrostatic pressure. So basically increase in aqueous humor production, obstruction of the outflow, and increased orbital hydrostatic pressure. Now there are three types, of glaucoma: primary, secondary, and absolute. So primary, as you can imagine, it's not preceded by a previous disease. I imagine it's hereditary, and actually when you go to the doctor, most of the time they'll ask if you have a history of glaucoma in your family. Secondary, there's some kind of lens abnormality like luxation or uveitis, for example, that's led to the problem. So usually for the secondary glaucoma, it's usually occurring because of a disease in the lens like luxation, or a disease in the uvea. So lens and uvea, and a good example of the uvea disease is uveitis. There's also absolute glaucoma. So these are glaucoma changes that are severe to the point where you get retinal degeneration, and you don't know if it's primary or secondary. Basically, it doesn't even matter because the patient's blind anyway. So what are the signs? We already know about increased intraocular pressure, but you can also see changes in the pupil and the iris. So, you can guess this is normal, this is abnormal. The iris is the colorful part around the eye. So although there aren't changes in this cat, there are changes here, I'll say mostly here. And what else? Episcleral vessels will be congested, so you can see the eyes are so red. Okay, so we'll just talk a bit more about these. So the primary, we use gonioscopy to diagnose this. So what happens is it sort of tells you the angle of the iridiocorneal angle. So let's try and find a picture to demonstrate this point. This isn't very helpful, so don't worry if you don't understand it completely, but yeah. Basically, under primary glaucoma, you have two types of glaucoma. You have open angle and closed angle primary glaucoma. So with the primary type, you have a normal iridiocorneal angle. With the closed type, you have an angle that's collapsed or covered with the peripheral iris or continuous tissue. In the secondary type of glaucoma, let's get there. Okay. You have open angle glaucoma again, but the aqueous contents or there are too many aqueous contents, or there's vascular hypertension that affects the aqueous humor. That's usually the case. What you'll see in the case of open angle secondary glaucoma is inflammation, which leads to the accumulation of inflammatory cells. Like, remember we talked about eosinophils being an example in cats, and it gathers in the aqueous humor. And one thing they've even named it is hyphema. Hyphema is when you have some of these cells, and the examples in hyphema are erythrocytes and fibrin. And what happens is they can obstruct the outflow of the aqueous humor. You also might have obstruction of the orbital venous return, and the lens, if it's luxated, can obstruct the aqueous humor outflow. Now with closed angle secondary glaucoma, it's related to the pupil being blocked, like by a cataract, luxating lens, increased volume of the vitreous humor, which displaces the lens. The vitreous humor is basically this fluid. So you have the aqueous humor in blue, vitreous humor in green there. And you'll treat secondary glaucoma basically with osmotic diuretics. So basically we use diuretics to decrease blood pressure for the heart. Osmotic diuretics do the same thing but for the eye, like mannitol. And the diuretics, yes, of course, decrease intraocular pressure. And we do an operation that focuses on the removal of the outflow obstructs, and this is called cyclodialysis. I'm not sure if there's even a picture of the surgery here, but you don't really need to know the procedure anyway. Yeah, as you can see, it's not here. Okay. And oh yeah, that's it. Okay, so diseases of the vitreous now. Let's get there. Okay, so we have three types: congenital, acquired, and degenerative diseases. So with congenital, you'll basically have persistent hyperplastic primary venous diseases. You'll understand what I mean when I speak more. Acquired, you'll have hemorrhagic diseases. There are also other types like vitreous inflammation and degenerative diseases like vitreal degeneration. So cataracts is a type of disease of the vitreous body. Okay, so what the hell is a cataract? This is lens or capsule opacity. So you can see the lens is just absolutely covered by something. And yeah, there are different types. You have congenital, of course, acquired, primary, secondary. It's kind of the same as what I just said. Age. So for example, there are different categories. I think they mentioned them here. Yeah, so congenital, neonatal, juvenile, and senile. Juvenile always means 5 to 6 years old. So like, let's say normal aged dog, where you won't be worried if it's too young or too old. Anatomic location, I won't say all of these, but axial is an example given. We also have cause, like trauma, so we'll call them traumatic cataracts. There's consistency, so if it's solid, soft, liquid, mentioned here. There's also the evolution. Is it a stationary cataract where it's always been there, it's not really changing, or is it progressive? Is it getting worse? This is usually in the case of, say, diabetes. Degree of opacification, so what this basically means, is it incipient, is it immature, mature, or hypermature? Don't ask me what incipient means. And yeah, anyway, so let's talk about congenital cataract. So this is blindness that you'll see at around 4 weeks old, and it can improve as the animal grows. You'll also see acquired cataracts, and basically we won't worry too much about the eye until like maybe the dog has lost let's say 60% of opacity, is when they'll lose quite a bit of vision. So how do we diagnose it? We use something called a focal slit beam. So there'll be a beam like this, and it'll go across the eye that you can use to localize the opacity's depth, and you'll treat it using, well, you can leave it, but you can also use atropine to dilate the pupils. This will increase the vision, because imagine, you know, if you increase the pupils, there'll be more vision around the opacity. And you'll do that a few times a day. You can open a Sky extracapsular extraction. Don't know what that is, and that's quite rare. Or you can do something called phacoemulsification. Whoopsie daisy. I'll just summarize it. So it's basically you cut the cornea open underneath, and you'll remove the capsule, which is here. So this is the opacity. And then you'll inject a new lens inside. And I think that's it.